Today's webinar will be conducted by Professor Suranjit Senaviratne, consultant immunologist, and it will be moderated by Professor Isandi Soisa, consultant surgeon. Professor Suranjit is joined with us from United Kingdom, and we are very much grateful
People
to you.
can't hear Sanjeeva. People can't hear. They are sending messages.
Oh, Nilupul?
Yeah, Ms. Sanjeeva, please.
How do I listen to this thing? What is happening here?
Hello, can you hear me?
Yeah, now.
Can you unmute all the mics, Nilupul?
Yeah, already done, Ms. Sanjeeva.
Hello, can you hear me now?
Yes, yes.
Yes.
Good evening, dear sirs and madam. We warmly welcome all of you to the Kalbe webinar on gut microbiome, immunity, and probiotics. Today's webinar will be conducted by Professor Suranjit Senaviratne, consultant immunologist, and it will be moderated by Professor Isandi Soisa, consultant surgeon. Professor Suranjit is joined with us from United Kingdom, and we are very much grateful to you, sir, for sparing your valuable time and knowledge with us. Before I hand over the sessions to Professor Ishandi Soisa to introduce Professor Suranjit Senaviratne, I would like to give all a brief. Hello? I would like to, before I hand over the sessions to Professor Ishandi Soisa to introduce Professor Suranjit Senaviratne, I would like to give you all a brief introduction about Professor Isandi Soisa. Professor Isandi Soisa is a professor in surgery, Faculty of Medicine, University of Colombo, and an honorary consultant surgeon of National Hospital of Sri Lanka. He graduated from the Faculty of Medicine, University of Colombo, Sri Lanka in 1992 with second-class honors in all examinations. He completed the Master of Surgery from the University of Colombo, Sri Lanka in 1992. He obtained both the fellowships of Royal College of Surgeons of England and the Royal College of Surgeons of Edinburgh in 2000. He was board certified as a gastrointestinal surgeon in 2002. He joined the Department of Surgery, Faculty of Medicine, University of Colombo in 2002 as a senior lecturer and honorary consultant surgeon to the National Hospital of Sri Lanka. In 2009, he was promoted to the professor in surgery. He was awarded Doctor of Medicine by the University of Colombo for his thesis on biomarkers in colorectal cancers in 2017. He is the president of the Sri Lankan Society of Gastroenterology and the president of Faculty of Medicine Teachers Association of Faculty of Medicine, Colombo. He has over 40 publications in peer-reviewed journals and authored 2 chapters in textbook of gastrointestinal surgery. He has won 8 Best Paper Awards for research presentation and a National Research Council Award for the publication in year 2016. His surgical and research interests including advanced laparoscopic surgery, upper GI surgery, colorectal surgery, and inflammatory bowel disease. Once again, we would like to welcome all of you for the Kalbe webinar, and let me hand over the sessions to Professor Isandi Soisa and Professor Suranjit Senaviratne to carry out further proceeding of the webinar. Thank you. Hand over to sir.
Thank you and welcome to this webinar on immunity, gut microbiome and probiotics. First of all, it is my pleasant task to introduce Professor Suranjit Senaviratne, who actually doesn't need much of an introduction to a Sri Lankan audience. Professor Suranjit Senaviratne graduated from the Faculty of Medicine, Colombo, with first class honors, 8 distinctions and 10 gold medals. He completed his MD in internal medicine and trained in clinical immunology and allergy at the John Radcliffe Hospital in Oxford. He completed a PhD in molecular medicine at the Weatherall Institute of Molecular Medicine of the University of Oxford as a Commonwealth Scholar. So far, he has authored 230 journal publications and has published in journals such as Nature, Science, Nature Medicine, Blood, American Journal of Medical Genetics, American Journal of Human Genetics, Journal of Experimental Medicine, and Journal of Allergy and Clinical Immunology. And it is not easy to get publications in journals like Nature and Science. Professor Suranjit is an international expert in allergic and mast cell disorders, immune deficiency, autoimmune disorders, and immunogenetics. He is the director of the Center for Mast Cell Disorders and the president of the UK Sri Lanka Immunology Foundation, an organization that contributes to immunology, allergy, and immunogenetics education in Sri Lanka. So let us now start this discussion.
Hello.
Hello, just right, Suranjit. So could you first of all summarize for us a little bit about the immune system, because most of our participants would have studied about immunology and immunity many years ago. So could you just summarize a bit about the immune system in general?
Right. Okay. Thank you. Thank you, Ishan. I hope all of y'all welcome everybody, and thanks a lot for the invitation, and thanks Ishan for the kind words. Now, if you look at a country, this is an analogy that I use. If you look at a country that is trying to attack an enemy, you have to have different forces: the army, the air force, the navy, and then you have the police too, and to get rid of any harmful influences on that country. And if you take it, so the defense system of the body is the immune system. That is the system that will protect us against harmful influenza, infections, and other danger signals. So you have different layers. You have the first layers, the ones that go very quickly to the site where the organism or the bacteria or virus comes in. And then you have the second system, the third system, etc. So the first part of the system is the innate immune system. And the second part is the adaptive immune system, where you have antibodies, white cells, something called complement getting together. So those different components, the innate immune system, the adaptive immune system, get together, talk to each other using chemicals called cytokines, chemokines, to attract different cells to the site that the action is, and they get rid of the harmful organism. So if you find the virus COVID, the SARS-CoV-2 come into the body, you get the immune system activated, producing cells against the COVID virus, producing antibodies against the COVID virus, and getting rid of the virus from the body. Now, if the system is not working properly, it will produce immunodeficiency. And that is the situation where patients come with lots of infection, chest, sinus, gastrointestinal, ear, eye infection. That is, the immune system is not working properly. But like all things, you get to a system where the immune system may be working in a incorrect way, where the immune system, it's like in the forces, if someone starts attacking people in the camp, that is not correct. They should be attacking the danger that is there. In that instance, you find that if the immune system is attacking our own body cells, then you would get autoimmune diseases that is attacking the own cells of the body. Or if it attacks and has a reaction to things like house dust mite, cat, dog, certain foods, etc., it is called allergy. So you have the general immune system for protecting against infection. If it doesn't work properly, you get a lot of infection. If that is called immune deficiency. And then you have on the other side, you have where the immune system does not function as it is set to do, it has to do, and then you produce autoimmunity and allergy. And for the maturation of the immune system, that is the most important thing. You do need the immune system to mature appropriately. And you need certain stimuli to be given to the immune system so that it matures and develops into a very robust and active immune system.
Right.
So that is in a nutshell some aspects of the immune system with regards to what it does, etc.
Right. Now, when you look at the gastrointestinal system, the main function of the gastrointestinal system, as we know, is digestion and absorption of food. But the gut is also considered an immune organ. So would you like to discuss some important aspects of gut immunity?
Exactly. So if you look at there are certain organs that are open to the environment. That is, the gastrointestinal system, the respiratory system, the urinary system, the skin is there, that's so sinuses, etc. So those have to have a very good interaction with organisms that come into contact with those sites. And if you look at the gastrointestinal system, starting from the mouth, going up to the anus, you find that you have, especially in the colon and small intestine, you have a very, very close interaction between the components in those sort of in the small intestine, the large intestine, and the immune system, which is just underneath the layer of cells that are separating the lumen of the gut, the middle of the gut, together as against the wall of the gut. So you have a whole lot of immune cells, lymphocytes, the cells of the innate immune system, in very close contact with other components that are found in the lumen. So that is why the food we take, the bacteria that is found in the gut, the sort of good bacteria, as we put it in colloquial term, has a great impact on how the immune system matures in the intestine. And because you have so many immune cells in the intestine and in the liver, if you take the gastrointestinal tract, the whole thing, because you have so many immune cells, and those immune cells circulate to other parts of the body and influence functions in other parts of the body, it has been found as an extremely important area of the immune system, because any change in the gut can influence functions in other parts of the body. And that's why we have this concept called gut-brain axis, etc., which has come into play, because the health of the gut is so important when it comes into health of the general systemic system as a whole. So the gut immune system is extremely important. It's very dense. You have a lot of cells and other molecules like antibodies, which they are to protect again. You have a good mucus layer, and that is in close contact with the food that goes to the gastrointestinal tract, together with bacteria, the sort of which we'll come into in the next few minutes, the microbiota, which are in close contact, and it influences the immune cells in the gut.
Right. Now, terms that we frequently hear nowadays are gut microbiome and gut microbiota. So could you explain these terms to the audience?
Yeah, so I think there are lots of terms that have been used uh, within this area. It's a rapidly developing field of medicine, and every month we find lots of new papers, lots of new data coming out, and it has sort of come into the journals in big time. And it's not only the gut microbiome. We have to remember that there are collections of organisms in other parts of the body. So you can have it in the intestine, you can have it in the lung, in the skin, and several other parts of the body. Because when we talk about conditions like asthma, when we talk about atopic dermatitis, again, the microbiome is important. Now, what is the microbiome and microbiota? I mean, that can be semantics, but just to explain, all the sort of organisms found in these in these parts that is of the body, that is the intestine. If you take the intestine, the gut microbiome, that's the bacteria, the viruses, the fungi, the different organisms. The whole combination of them is called the microbiota. It is called microbiota. Now, each of those organisms have genes, right? Because the genes are the ones that produce the proteins, which is the ultimate action. So the collection of genes together of the different organisms is called microbiome. So you have the microbiota, and then you have the microbiome. And the important thing which people should remember, that 2 kilograms of our body weight consists of the microbiota found in our gut. So 2 kilograms are carrying of the microbiota. And the other important thing is we have 10 to the power 13 cells in our body, human cells. We have 10 to the power 14. That is 10 times or 100, and sometimes it's 100 times, but the standard thing is 10 times the number of human cells that is found in our number of sort of microbiota that are found. It's about 10 times the number of human cells. So we are made more of more cells of a different organism than compared to humans. So we are walking around with about 2 kilograms of bacteria in our bacteria and other organisms in our gut. And in addition, it is about 10 times the amount of human cells in our body.
Right. So if you say that we have more bacterial cells than human cells and about 2 kilos of bacterial cells, does it mean that the human cells are actually heavier than the bacterial cells?
That it is definitely, it should be the case because they are bigger cells, etc. But the important concept from that is to consider is that comes out from that is, you know, you don't, I mean, previously, if you looked at the immune system, it was the innate immune system is not very important. And now we know that the innate immune, the first part of the immune system is extremely important. If it doesn't function well, you get disease. If it functions overactivity after that first part of the immune system, you get disease. Then if you look at genes, previously they thought exons, the protein producing part of a gene, right, that coding part is important. The intron, the part between the exon, was not important. Now we know that that is not so, that it has so many important functions. So basically that what it points to is, guys, most things within our body are not just there for redundancy. There is some function that it is playing. So 2 kilograms of bacteria, 10 to the power 4 microbiota, they are not just lying there doing nothing. And the important thing is that they are doing some function and modulating different function of the body. And one of the important thing it modulates is the immune system, the immune function, so that the immune system will function properly.
Right. Now, I remember learning in medical school that, you know, when a baby is in utero, the gut is sterile and that, you know, the bacteria get in after that. So could you explain how this gut microbiota gets established, or when this gut microbiota gets established,
Yeah.
and also whether it changes during life?
Yes, so good questions. I mean, definitely at birth, depending on the form that is used for the birth, that is natural birth, or whether it's a cesarean section, the gut microbiota would change because the exposure to the different microorganisms is different depending on the way the child is born. And we know that different countries in children, different countries, say in developed countries versus developing countries, in Africa, etc., the gut microbiome is definitely different. And that is why people have trying to intervene quite early to prevent the sort of bad gut microbiota getting into the picture and causing diseases, etc., and causing the immune system to not mature properly, as opposed to the good microbiota, which can be cultivated and can be improved during life. So the gut microbiota definitely changes during life. And that is why when you look at diseases, you have genetic factors that the person is born with, you have environmental factors, that is the food you eat, the environment that you live in, the sort of the external environment, together which influence components such as the gut microbiota, which in turn influences the immune system, and thus the immune function matures in the direction it has to mature, as opposed to maturing in a way that you get autoimmune disease, allergies, etc. And certain populations are prone to getting certain diseases, and that's the very important thing. Certain genetic factors can influence people getting different conditions. So to answer that question, yes, the mode of delivery is important in determining the initial microbiome, and then from that point onwards, depending on the living sort of living the child is brought up, the diet, etc., has a big influence on the final or the maturing or the developing microbiota, and that definitely changes during life. And there are some beautiful studies that have been done on that. So with that change in gut microbiota influence the immune system, you can find that the immune system matures, and you want to match it to mature in the correct way, as opposed to a incorrect, dysregulated way.
So it's not just the number of bacteria that matter, right? It is qualitative as well. It's not just
Absolutely. That is very important. Now, I mean, in most things, right, you don't look at number alone. You look at number and function. What do the gut microbiota do? What do they do? They produce chemicals, short chain fatty acids, other important chemicals, which I won't go into technical detail. They produce those factors that influence cells in the immune system, influence the epithelial cells, that is the cell lining the intestine. So it is very important to identify the function of those cells. It's just not numbers. And that's the important thing when you're replacing or changing the gut microbiome. You would try to use a combination, because different, say, bacteria, let's go on bacteria because more is known about bacteria. If you look at bacteria, different bacteria have different functions. So as a result, you find that it is not only the number, but you must have diversity. It should be a difference. There should be a whole range of different bacteria having different good functions, and that is what you want. You have in colloquial terms, good bacteria, bad bacteria, or as you would say, good cholesterol, bad cholesterol. So you want a range of good functions to come together to influence, and that is why it's not only numbers, it depends on the numbers and the function, and that is why new fields like metabolomics, transcriptomics, I mean the sort of the microbiome, gut microbiome, transcriptomics, metabolomics, proteomics, etc., is come into action to identify those functions. So you can detect what organisms there are, what are the chemicals they are producing, to get a composite or whole picture as to what these gut microbiota are doing there and how are they influencing the immune system.
Right. So if we were to move away from the gut microbiome and talk about probiotics. Now you hear about prebiotics, probiotics, postbiotics, and so on. So could you explain what these are?
Yes, so I think those are terms which a lot of people are hearing. Probiotics. So probiotics are basically living microorganisms that has a beneficial effect on human health. So living microorganism, that's the important thing. Prebiotics are not organism, not bacteria. It is some substances like few oligosaccharides that stimulate the growth of the good bacteria. If we take bacteria, we'll focus on bacteria here. So you have probiotics, which are living organisms. You have prebiotics, which are substances that promote the growth of those good organisms. So, I mean, the two can be combined together. So you can have certain instances where you have a prebiotic and a probiotic put together. Postbiotic is just the organism that is the killed organism, which is having similar functions like that. Then you have immunobiotics, which has some very important immune action. So basically, when we look at it, we talk about probiotic, which are the living microorganisms, and then you have the prebiotics, which are those that stimulate the organisms to grow and help their growth.
Right. So are there any foods that will promote, now say you give somebody probiotics, right? Are there any types of food that will promote these probiotics to grow?
Yes, exactly. Things like fiber are well known to produce, and there are other foods which are listed, sauerkraut, etc., which have a growth promoting action on the good bacteria of the gut. Now we have to balance this because this is a very important thing. You cannot have an excess of anything when looking into gut health, lung health, skin health, etc. So when we talk about fiber, you must ensure that there's a range of different fibers that are taken rather than one type, because we want diversity. You have different measures called alpha diversity, beta diversity in the bacteria. That's more technical, but we want diversity, a whole different range. So a range of fiber. And in addition, we have to remember that other foods also can help the growth of the good bacteria or the microbiome or the microbiota. However, we must remember that certain foods have increased levels of some other chemicals that may not have good effects on the intestine, like histamine, mast cell chemicals, etc. So we must take that into account when we are selecting probiotics, when we are selecting foods, etc. Because overall, gut permeability is extremely important. This concept called leaky gut comes into the picture. Lots of people are talking about leaky gut. You do need to know what is actually known about leaky gut and what is actually a lot of myth that is going about leaky gut. And so the influence is gut, the bacteria can produce substances which can have an effect on the epithelial cells of the intestine, the covering of the intestine, and can have an effect on the immune system. In addition, you have certain foods that can promote those bacteria, certain bacterial growing, and you have other foods which, though it promotes, it may cause other not so helpful effects. In addition, if you're starting with on a bad wicket where there's hardly any bacteria, not hardly any bacteria, hardly any big numbers of the good bacteria, whatever food you take, there's nothing for it to grow. So you have to have the base properly, and then you take the specific foods, then you find that those can be grown and multiply to produce the good effects.
Right. So now these prebiotics and probiotics are also considered as therapy in certain types of GI disorders. What is the role of these in inflammatory bowel disease, that is ulcerative colitis and Crohn's disease?
Yes. So now, if we look at the use of these, so if we take a situation where what can happen to the intestine, you can find that there can be the motility of the intestine being affected. and that is irritable bowel syndrome, etc. Then you find the intestines can be inflamed, depending on the condition, ulcerative colitis, Crohn's disease, etc. You can find that different parts of the intestine can be inflamed. Then you have other gastrointestinal infections. And one tricky infection that is there due to the misuse of antibiotic is Clostridium difficile infection, which is very difficult to get rid of in certain people and can cause a lot of problems for the morbidity symptoms and even death in number of patients. So what has happened is people have looked at normal healthy people with normal gut health and looked at the numbers and the function of the gut bacteria. That is, they are the microbiome or the microbiota. Then they have compared it with patients with inflammatory bowel disease, irritable bowel syndrome, Clostridium difficile infection, and you name it, a whole range of other conditions. And they have found changes. Important lactobacilli are reduced. Important Clostridium species are reduced. Bifidobacteria may be reduced. Certain other bacteria which should not be there are increased. So therefore, what could you do? And that is very well defined in a condition like Clostridium difficile infection. Very well defined, because in Clostridium difficile infection, it has been defined and people have replaced the gut microbiome and found that it helps the patient. In inflammatory bowel disease, we do find changes. We have found changes in the gut microbiome, and we know the changes. It can vary across the different populations, in different degrees of severity. However, we know that, and that is why certain interventions are considered to be able to correct the gut microbiome in these conditions. Now, we have to remember the data so far is quite robust in Clostridium difficile infection, which is a difficult condition to treat in certain patients, as opposed to while the data in inflammatory bowel disease is developing. That is very important, developing, and we'll get clearer picture as the months go by.
Right. And
so you can combine both prebiotics and a probiotic in that instance. And then you have the other element where you would I suppose you will ask me this, where you can give a fecal microbiome transplant.
Right. Now, that brings us to an interesting question about Clostridium difficile infection and pseudomembranous colitis. Now, at the rate that, antibiotics are being used and abused in Sri Lanka, we don't see that much of Clostridium difficile here as compared to Western countries. Do you think it's because our microbiota is different?
I mean, definitely microbiota would be different across different countries. That is so, right? So in certain countries, you might find the difference in microbiota leading to Clostridium difficile infection on the genetic background of the person and together with other environmental factors. Whereas in certain patients, the change in gut microbiota may predispose the person to getting more autoimmune diseases, more allergies, more tricky issues with metabolic conditions or sort of obesity, etc. So it depends on as I said, it can't take one thing in isolation. True, a lot of antibiotics are misused in Sri Lanka, and that is a program that is being looked into to reduce drug resistance, etc. If you find that Clostridium difficile infection is not such a problem in Sri Lanka, you cannot turn around and say, okay, so therefore we can misuse antibiotics, because there could be so many other effects that can be there. There may be a genetic element why you're not getting it. There may be other environmental factors why you're not getting it, etc. But overall, the misuse of antibiotics together with the effect on the good microbiome could have quite a lot of downstream effects on autoimmunity, allergies, and other conditions. I mean, there's lots of studies being done on conditions like autism, sort of in the mental health arena. However, the data are still being analyzed and we don't have robust data from that area. Although some may say, yes, it is, but still we have, it's developing data. But those are important because metabolic syndrome is a problem in Sri Lanka. That could be influences on on those areas of medicine, and depending on the population, they can have different effects.
Right. So now one of the commonest lower GI disorders is irritable bowel syndrome, where, as you know, there is no inflammation in the gut. It is just that, you know, the gut is more irritable and you get bowel spasms and so on. Now, is there any place for either prebiotics or probiotics in IBS?
Okay, so I think IBS, you'll carry out a sort of a range of things, because you'll have to go into the patient and see what are the things that are aggravating this patient's symptom, because you don't say one thing alone is sufficient for irritable bowel syndrome. You'll exclude inflammation, you'll exclude underlying more sinister pathology, and those are important. Most people would have the gastrointestinal symptom, irritable bowel syndrome, and you will take a sort of overall view. And in addition to sort of prebiotic probiotics, which have been shown in several studies to have a beneficial effect, you wouldn't only just take that as an intervention, because if the person is having issues with histamine and effects or gut motility or increased gut motility to other factors, anxiety, driving the whole process, you will look into, or bad dietary habits, etc. You will look into those aspects too, rather than only focusing on one. So when you talk about gut microbiome, it's only one factor. That is an extremely important thing to remember, and it is not to be taken as the only factor, because otherwise you'll be correcting that. But you'll be finding the person just taking probiotics or prebiotics but still having the symptom. You have really not gone to looking at the whole range of things that are driving this. So yes, it is. Studies have shown it. It's not as robust. The data is not as robust as something like certain things like the infections, but it is being used in irritable bowel syndrome as one of the intervention rather than as the sole intervention.
Right. So if we were to move away from the gastrointestinal system, now the gut microbiome has been implicated in allergies as well as in bronchial asthma. Could you give us a few insights about that?
Yes, so this is the systemic nature of the effects of the gut microbiome. We know that the lung has its own microbiome. Previously, they thought that the lung didn't have any bacteria or any organism, but that was found to be not so. Very beautiful studies have been done which showed changes in the organism pattern in the lung with certain chronic lung diseases or acute lung diseases. Beautiful study. So could we modulate the microbiome at another place to affect allergic responses, to affect asthmatic responses? Yes, but it has to be a intervention at a correct time period. You can't wait till 65 years of age with person having very bad asthma and chronic lung disease, give 2 or 3 months of probiotics or prebiotics and assume that everything will change. I mean, it's structural damage has occurred and that has been established. So that is why people are talking about what is the period of intervention. When should we intervene with regards to the gut microbiome and other microbiome, because there may be a window of opportunity to intervene. If we don't intervene during that period, we may miss the bus, and therefore the changes can be established in our body, and therefore you'll find it difficult to change. So that is important. This is different to infection. We are talking about inflammatory conditions, autoimmune condition, or allergic state. So people are using this components, the prebiotics and probiotics, but at an early stage in life, so as to modulate the immune system. The dysfunctional immune system that can develop is changed. It is prevented from going down the wrong route. You're directing the child down the correct route. In the same way, you're directing the immune system not along a route that you don't want, but in the route that will be helpful to the body, and it will function in protecting the body rather than producing autoimmune diseases, etc. So that's a very important concept that people are working. And another important thing with things like probiotics, which you do need to remember, is that you should have a diverse amount of organisms that are taken in the probiotic, not just one organism, diverse, so that they will be producing different function, different chemicals when they go and get established in the gut. They should not be destroyed in the stomach, because if they are going to be destroyed in the stomach, then there's you're taking something, but it's going to be destroyed. So you want it to go to the appropriate place and be able to colonize that place and therefore do its function. So there are certain important things that are needed with regards to the given probiotic or prebiotic. And in addition, in a condition which we didn't touch too much, that's Clostridium difficile infection, where feces is taken, processed and given to people to treat. Feces from good, that is from people with healthy guts, are taken to treat people who have very intractable infections, really intractable infection, and that is called fecal microbial transplantation, FMT. Very established process in those conditions like Clostridium difficile. One important thing to remember there is you can give it in different formats. You can give it in a capsule format, etc. Now people are trying to identify the important components of the fecal material from a healthy person, and can we give those components rather than giving sort of whole fecal transplants, etc., which can be not viewed very positively by a lot of people unless they have a very severe infection. So can we identify the components and give it to the sort of a person to improve his health? If you look at in COVID, it's the same thing. Right, in COVID, we are giving antivirals, we are giving anti-inflammatory, etc. But you have this process where you give convalescent plasma. So what are we doing? You're taking plasma from people who are recovered, and it's assuming that they have good antibody, we can measure it as an antibody level. You're giving it to people with severe disease. So you're taking something from a person who has that and giving to, so same thing, gut microbiome, fecal microbiome transplant, you can do that. You can give it to the person. Very important thing has to be remembered, because always in medicine, you have the people who push the boundaries beyond what the data is showing at the moment. And that is a problem. Fecal microbial transplant is good in certain conditions. The data shows it. It's not good in everything under the sun. That's an extremely important thing. That's where hype comes in and takes over medicine. And then you find you do not know where you're going. Probiotics, prebiotics, fecal microbial transplantation are good in the correct context and in the studied context where each of those have been found to be beneficial, right? So the important thing is everything possible should not be considered as we must give them a fecal microbial transplant that will help them. And that is the tricky area. I've seen immune deficient patients getting fecal microbial transplants. And that's a tricky issue because you're giving live organ, a whole range of live organisms. And unlike a probiotic, we are selecting different organisms, live organisms. Here, what is happening is you're giving this whole amount of organism in an area that has not been really studied in detail. So one has to be careful, follow the guidelines, follow the research that has been going around the world, and do it in the correct context, right? In the correct, because studies have been going, and keep up to date, because as studies come on, people will realize that, okay, these are the conditions that probiotics, prebiotics, and in lesser amount of instances, fecal microbiome transplant is important.
Right. So speaking of guidelines, what are the guidelines you would recommend? I mean, are there nice guidelines, from the National Institute of Clinical Excellence or the British Society of Gastroenterology or the American
Yes,
Society
so
of...
there are some good guidelines in the American Society of Gastroenterology or British Society of Gastroenterology on the use of these different agents. The American Academy of Allergy and Immunology when it comes to allergy, or the ERS or the ARS, American Respiratory Society or the European Respiratory, with the use of these different intervention in the groups of patients. And the important thing is to, update your knowledge at intervals, because guidelines do change, right? And what was available last year gets updated as more knowledge comes in and more information comes in. And that is an important thing, to be updated with different sort of fora, etc., about the beneficial effects. And even, if I don't know if you would consider this aspect of atopic dermatitis. That's another area where the microbiome is coming in a big way, because the skin has a lot of bacteria. The skin has a lot of bacteria on its surface, and in patients with eczema, you find that at the time when their eczema becomes worse or they get a flare, at present, what are we doing? Steroids, immunosuppressive treatment, some antibiotics. That is the treatment at the present. Steroids, steroids, steroids. And that is not good over a long period of time. Steroid creams have to be used. Yes, use it wisely. So therefore, people are looking at other aspects. And beautiful studies have been published in atopic dermatitis, where you find that with certain bacteria called Staph aureus, Staphylococcus aureus are increased, and they have shown, at least experimentally, and now creams are coming into the market where they can take good Staphylococcus or products of the good Staphylococcus to be able to use it as a cream in these patients with atopic dermatitis, not Staphylococcus, that is, other bacteria, not Staphylococcus, non-Staphylococcus, to be able to balance the skin and to able to rebalance the microorganisms that are found in the skin, and so that there is no predominance of Staphylococcus aureus alone.
Right. And one final question, is there any benefit in using these in autoimmune disorders?
Oh yes, so I think that was I think on 2 occasions that the Sri Lanka Medical Association, once in Sri Lanka Medical 2 years ago, I gave this talk on autoimmunity and the gut microbiome and interventions, and then at the College of Physicians also. So if we look at the immune system, Ishan, what happens? Immune system protects us against getting infections or other harmful things. If it's not working properly, you get immune deficiency. Then you have the immune system misbehaving itself, like a naughty child misbehaving, setting damage in the house. So what is it? Autoimmunity. And then you have allergies, reacting to things in the environment. We know in allergies, if you intervene early, again, you can modulate the immune system and change it into a different pathway. Autoimmunity. What is autoimmunity? Where the immune system suddenly decides to attack itself. And that is regulated by different processes occurring very much earlier. You produce antibodies against your cell, and sometimes you can have it for years before you get autoimmune disease. So you have autoimmune antibodies or autoimmune cells, and then it goes for several years. So if you can modulate the gut microbiome early on, you may prevent the immune system producing those autoantibodies or autoimmune cells. And if you can modulate after, say, then there's a group of patients who develop those antibodies. If we can intervene at that stage and prevent in producing disease, just because you have the antibody doesn't mean that you will develop disease. So there is a stage process. And that is why intervention should be done early to prevent the development. And once it develops, you intervene to prevent the progression to disease. So when it comes to studies in autoimmune disease, definitely it is very much less than in infections like Clostridium difficile. But again, inflammatory bowel disease is autoimmune condition, right? You have the immune system waging war in the intestine. That's basically what, if you look at the intestine and take a view at the intestine, the number of immune cells there, it's packed with immune cells. So those immune cells should not be in that intestine, attacking the intestine. That's why you get autoimmune inflammatory bowel disease. So again, you can find with probiotics can be used to modulate that process, but an early intervention will be far better than a later intervention when things are established. Because one thing with medicine and in immunology and other so many conditions, you intervene early, because if the horse has already bolted out of the stable, it's more difficult to get things back to normal. That is why even in eczema, when there's a flare, you treat early. You don't wait till it's absolutely raging. And that's a mistake a lot of people do tend to make. They don't treat it early, and then by that time things have gone out and the immune system is really going out of control. So early intervention is important. And autoimmune disease, lots of research has been done. I haven't gone to the different studies, the named studies, etc., due to time constraint. But one important, I think a term which we didn't mention in this talk so far is this word called dysbiosis. So dysbiosis is the microbiome is not functioning properly, and we want to change from dysbiosis to homeostasis. So dysbiosis is something, these terms have been used, dysbiosis, leaky gut, etc. These are terms meant for specific things, not everything around any symptom the patient have. And dysbiosis is what we can look at and try to change it to homeostasis.
Right. Okay. Thank you very much, Suranjit, for a very interesting session. There are a few questions from the audience, and I think we will stick to questions which are relevant to the topic under discussion. Now, there is a question from one doctor who says that he or she has come up with a research that was conducted in Belgium, where in patients with depression, they found that there were lesser concentrations of Coprococcus and Dialister bacteria in the gut. And he's wondering whether this would open a new pathway to treat depression.
So, good question, very good question, appropriate question. Now, what happens, as we know in medicine, when some intervention, such as use of probiotic or such as the change in microbiota becomes known in one or two conditions, and when that has effects on the immune system, and we know the immune system is so vital across a whole range of conditions, people would measure microbiota concentrations, etc., in deficiencies. So that's the first thing people will do in a whole range, neurological, cardiological, etc. Now, the important thing to remember is that many studies should be done. You cannot go by one study alone, because there can be bias in that. Many studies, and if there is a reproducible trend in that, and if it is scientifically plausible, right, that is one area that you would go further. So especially when it comes to interventions with different sort of supplements, different other trace elements, microbiota, etc., lots of studies come into the literature. And then it's the idea of scientists to take those studies, always have that thing. Okay, that's one study. Let's see if there are many other studies. So you do a systematic review. Then you look at meta-analysis. If there is sufficient, you have a quantification, you can quantify. And then if it's positive, you would say, yes, this is a plausible, this is possible. Then you intervene. Then you do the standard way, like in all conditions. We will do an open study, but open studies can have bias. Then you do a blinded study, a double-blinded study, etc., to be able to identify, yes, this is beneficial. So when it comes to conditions like depression, anxiety, autism, etc., many studies are coming from across the world, and it's a developing area. I think anyone in the mental health fields and the developmental behavioral fields will say that these are areas that people are indeed looking at. What is bad is to say, okay, that's the only intervention. That is the only thing that we should be thinking about. That's not medicine. It's a combination of things that we should be thinking of that influence the body on a genetic background. So yes, studies have shown changes in depression, in manic states, in dementia, etc. However, it has to be reproduced, and those reproducibility should be robust. And from there, you go on to studies. So there are well-defined conditions, there are developing conditions, and at the moment some conditions where we don't have any evidence. So I think that is the sort of spectrum. So as years go by, the conditions that are developing, the evidence-based developing, could move into, yes, we are more definite in that, or could move into, no, we know that it is not the case.
Right. That is the
Very
only,
good question there, yeah.
yeah, that's the only question that I can see. I don't know whether you all can see any more questions in the written format, but are there any questions that anyone would like to ask directly from Prof. Suranjit?
Ishan, I don't think that's possible because they are all muted, right? So they can't ask questions.
Why have they been muted? I think now the organizer can unmute them.
Yeah.
Okay.
Nilupol, please unmute.
Yes,
Please
And it's
unmute.
3 o'clock, right? It's 1 hour.
It is possible to treat with the bacteriological treatment for the Helicobacter pylori infection.
Yeah, so I think that is a very interesting question. With definitely Helicobacter pylori there is treatment that is given. I think that is one other thing. If you find that in certain instances the bacteria in the gut are really dysregulated and you have small intestinal bacterial overgrowth, that is called SIBO. Right,
Yes.
SIBO, small intestine bacterial overgrowth. We have tests that we can detect there. You can measure the sort of hydrogen. There are certain specific tests that can be done, and you can see if the person has SIBO. And SIBO can cause gut leaky gut and sort of issue translocation of certain components across the gut membrane. So in that instances, another intervention in addition, because if you have those dysregulated bacteria, when you give probiotics, the probiotic may not be able to take over its action. So probiotics are coming from one direction, right? But you want to get rid of those harmful bacteria. And that's the stage you would use something like rifaximin, right? Rifaximin to get rid of those bacteria, and people give it for 2 weeks. Again, rifaximin must be used in the correct context. Not everyone come in with a bit of abdominal bloating, etc., because that is absolutely not the place that you have to go with rifaximin. It is the place that you can demonstrate spontaneous bacterial growth so that you get rid of the bad bacteria there, and then you come in with the probiotic, because that would help the whole process. You come in 2 directions. It's like coming in 2 directions. You get rid of one and you bring in something else to replace that that function.
Right. Any other questions? I believe SIBO was also implicated in non-alcoholic steatohepatitis or NASH at one time.
certain theories have come through, and I think the important thing is the robustness of that study. I mean, you always, as scientists, we never go with one study unless it's a massive big study, which is absolutely a big effect size. But otherwise, you would always look for reproducibility and repeatability.
Right. There is also another question whether there is a place for probiotics in acute bacterial gastroenteritis, because a lot of physicians actually prescribe this for acute bacterial gastroenteritis.
Yes, so I think the literature is sort of a split there. Yes, if you look at it physiologically in acute bacterial gastroenteritis, you find that there could be overgrowth of certain unwanted bacteria, and when you treat it with antibacterial agents, you would also prefer to get the good bacteria back into that location. However, we must remember there have been a few studies, especially not more than bacteria, it's viral gastroenteritis that has been published recently in children, very small children. But there are issues with some of those studies where they have said that the effect size may not be as prominent as previously thought. But definitely, I know across the world, people do use it when they use antibiotics for treatment. At some stage, they use it. Again, that's something that data is being collected, and it should be, you should follow the data as it comes to indicate whether it should be used or not. If suddenly a lot of studies come and say it's not indicated, then practice should be changed at that time.
Yes, I think also one of the problems is diagnosing it, isn't it? Because most of the labs only culture stools for Salmonella and Shigella. They do not for other organisms.
Yeah.
Any more question? Yes. What does chemotherapy do to gut flora? How could it be restored thereafter?
Okay, so now we are good question. I mean, excellent questions if you look at it, because you know that chemotherapy can have an effect. It's killing a lot of. Basically, what is chemotherapy? Chemotherapy is being given to kill the cancer cell. That's the reason. One cell has decided it is going to misbehave and going to grow on its own. Starts growing, and the person gets a cancer. How do you treat it? You remove as much as possible using surgery. Some people get radiotherapy, some people get endocrine therapy, some people get chemotherapy. Chemotherapy is an important field. And then we have the other one, targeted therapy, immunotherapy, etc. So chemotherapy, what happens? What are we doing? We're using certain toxic agents to kill the cancer cell. When you kill the cancer cell, what can happen? You're going to affect other cells. You're going to affect your other human cells. And what are the cells that multiply a lot? It's the cells in the gut, gastrointestinal tract. It's the cells that in the skin, etc., which are the ones that multiply a lot. So those cells are going to get affected. And those are going to be, those people get diarrhea, nausea, etc. Right, the rapidly dividing cell. It affects the immune cells. The immune cells are multiplying. And when the gut is dysregulated, you find the gut microbiome can be changed. Right, because the interaction between the not that chemotherapy directly attacks the bacteria, it's not antibacterial, but you can find the milieu is changed there, because the gut is inflamed, the gut epithelial cells damaged, etc., because it's multiplying, and then you can find that the gut microbiome can be affected in those instances. So that is the rationale behind giving some probiotic, but we have to be careful, because at the height of, some people delay it a little bit, because at the height of the chemotherapy, there's a little bit of immunosuppression, and you have to be careful with giving some of these organisms. But as it's settling down, that's the stage you will start off on the probiotics and the prebiotics.
There's a good question from Dr. Manavadu.
It's Ishan. I can't hear.
Yeah, so this question is whether probiotics should be given along with antibiotics. Because when you give antibiotics, you kill both the good and the bad bacteria. So the question is whether probiotics should be given along with antibiotics.
Right. Okay. So again, a mixed views, right? I mean, that is split down. Some people say yes, give it, but most would give the antibiotic, and then as it's coming to an end, you give the probiotic. That's the view. That is the predominant view that we follow here.
Yeah, that tends to make sense, isn't it? Because otherwise, the
Yeah.
antibiotics might destroy the probiotic also. Right. Can people who don't show symptoms of celiac disease could show gluten sensitivity? If so, how can one detect it?
Now we are going into gut health and other conditions, right?
Slightly outside the line of the off stump there. It's
Yeah.
about celiac disease.
Sorry,
Yes.
what is the question?
Yeah, it is whether can people, I'll just read it
Are we,
verbatim.
Ishan, are we going beyond time? It was 1 hour, but I can answer this question.
Yeah,
I'll answer this question.
I'll read it verbatim. Can people who don't show symptoms of celiac disease show gluten sensitivity?
Yes,
So,
definitely.
right.
Yeah, definitely. Because there is a condition, a classic condition called non-celiac gluten hypersensitivity. So wheat and gluten hypersensitivity has a whole range of manifestation. So you don't have to, celiac disease is a specific condition due to that is but you can not have celiac disease but still have gluten hypersensitive, very well known condition, and that is a very, very common condition that we encounter, and we can test it, and that is definitely, you have to have a good history you have to go through, but there are very well defined cases of gluten hypersensitivity, non-celiac gluten hypersensitivity, very, very established condition.
Yes. And another one, to increase children's immune function, is there any need to give probiotic supplementation to children earlier? If I am not wrong, there is a journal that explains about immature antibody during the first 6 months of life.
Yes. So I think more than immature antibody, the child, the first at least first 4 months, that it's the IgG antibody is what the mother transfers, right? So that is the important thing. That is why you want the mother to be healthy, etc. The antibody that is transferred is the immune system matures from the day the child is born, but it takes time to mature. So therefore, your antibody responses, etc., take time to mature. And that is why when we give vaccinations, we give conjugated vaccination when the child is less than 1 year. Conjugated means you have a carbohydrate component of a vaccine and a protein component. That is something like Prevnar, right? The pneumococcal vaccine. You give it because you assume that the carbohydrate, the sugar component of the vaccine cannot, when I say sugar, not that they add in sugar, but carbohydrate component is not robust enough to stimulate the immune system. So definitely that first year is extremely important. Up to 5 years, it's important. The immune system shows so much of plasticity during that period. It is an extremely important period of development, and that is the time that any influencers, any sort of microbial alterations, any allergen avoidance or allergen introduction or food introduction should occur. And that you all know about the situation where people were not giving certain children a whole range of foods such as the things like nuts for a long period of time, for till they were 2 years, etc. And we were causing more allergic diseases to nuts, etc. by doing that process. Pregnant ladies were initially said, do not take nuts. Now we say, no, go ahead and eat nuts, and a normal diet sort of thing. So that's very important, because if you misread the immune system and intervene at a wrong time and the wrong way, you're going to cause more disease, as happened with the allergies of avoiding certain foods when they were very young. And now it is introduced in its early introduction of certain items of food to prevent the problem occurring, because the natural default thing of the gastrointestinal tract is to tolerize, to not become allergic. When you take a certain things in the gastrointestinal tract, that immune system should switch off, and or switch off means it should not attack that. But if you get that same component through the skin, when the child has eczema, then you find that the immune system can go down bad or incorrect routes and cause disease. So that is the important thing that one should remember, that the intervention should be at a correct time, and the developing immune system should be looked after in a child. And it does not mean that you don't, this comes into the hygiene hypothesis and the modified hygiene hypothesis. You have to intervene properly.
Right.
At the
And
correct
there is
time.
also a question which I think was previously answered, and that is about at what stage
Ishan,
with
hello.
gastroenteritis. I think you have answered that.
I think you're going over time.
Right. Okay. So then we have to close this session. But before that, there is a vote of thanks from Mr. Nilupul. And thank you very much for Suranjit for answering my questions as well as the questions from the audience. Over to you, Nilupul.
Thank you very much, sir. So I would like to convey my vote of thanks, dear sirs and madams. Good evening to all of you. So on behalf of Kalbe, we would like to thank Professor Suranjit Serivaratne for his valuable time in joining us as our speaker, despite of his busy schedule. Thank you very much, sir, for your thoughts and inputs in making this event successful and fruitful. Also, we would like to thank Professor Ishan D'Souza for his valuable time in moderating this event. Thank you very much, sir, for your thoughts and inputs in making this event a success. And last but not least, I would like to thank all the doctors who participated in the Kalbe webinar on gut microbiome, immunity, and probiotics. Thank you very much, dear sirs and madams, for making this event a success. We hope to see you soon again. And
Thank you.
thank you.
Thank you. Thank you very much.
Thank you.
Thank you.
Yeah. Noticed a couple of our batchmates also. I saw Sandhya there.
Yes, sir.
Thank you, Suranjit. Thank you, Ishan.
Okay, thank you.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you. See you.
I can see Anoma too.
Can you?
Yeah, I can see Anoma.
Yeah. I think Manavadu is here.
Yes. Good to see you all.
Yeah.
Okay, take care. Bye.
Bye. some we are the champions, my friend.
Prof. Ishan, especially thank you very much. Prof. Suranjit,
Thank you.
thank you very
Thank
much
you.
for helping us to make it very successful.
Thank you. I think
Thank
Suranjit
you.
probably left. He must be busy.
Yeah, he must be busy. He might have another appointment. I believe that.
That's right.
Yeah, he might have. He's a very busy person.
There were a few from overseas also. I noticed there was someone from Cambodia and so on.
Yes, because the Kalbe, we do have operations. Then some of them we just paste it in our international forum. Then
Right.
they just join with us.
This Zoom now, we had 212 at the optimum time. I mean, I have lectured to about 160 medical students. At the sort of maximum time, we had about 212. Is there a limit to the number you can you have even 1,000?
We can go up to 500. Sir. In our
Up to
platform,
500.
we can go up to 500, but
500.
there are some enterprises, there are some packages. We can purchase according to our requirement.
Right. We of course get it from the university, so it's actually free for us, and we use it to teach.
Okay.
Thank you very much, Sanjeeva. Thank you.
You are most welcome, sir. Thank you very much for your assistance and the kindness regarding to make it very fruitful. Thank you very
And
much.
thank you, Anilupul.
Yeah, and Vishan too. Vishan is the person coordinate all those things with you.
Yes, thank you to him too.
Thank you, sir.
Thank you. Yes, you're the man.
But today there was another webinar, sir. That's from the Lanka Hospital. That's the independent medical practitioners. That was
All right. Okay. And what was that about? What was the topic?
That's related to the COVID, the management.
All right. Okay. Yes, I think so. That was, I think, something that was coordinated by the Sri Lanka Medical Association. I am not sure. No. IMPA. You're correct.
IMPA.
Yes.
The Lanka Hospital, they sponsored the event.
Yeah. Right. Then thank you again. Thank you very much.
Okay, sir. Thank you
Thank you
very
very
much.
much, sir.
Good night.
Thank you, Professor. Good night.
Night.
Thank you, Mr. Sanjiwa.
You are most welcome. Good night.
Good night.
Lina.
Yeah.
Yeah. Finally, we will. Okay, we will talk it later. Now, because I know.
Excellent speaker and moderator.
Yes.
I'm happy for today's webinar because we have excellent speaker and also moderator and excellent sharing about the probiotics and also immunity.
Yes.
It's very valuable information for us.
Yes. Yes.
Thank you all. Thank you, Nilupul.
Welcome.
Thank you.
Masih webinar.
Yeah, thank you. Yeah, you're welcome.
Okay. But some of our doctors. Aditya.
Yeah, Adit help us for the technicals of Zoom.
Yeah. That's why. I want to give my warmly this thing for Adit because he
Adit.
has he facilitated. Adit, thank you very much. Adit, thank you very much. Lina, thank you very much. Adit, thank you.
Thank you all. Thank you, team. Thank you. Bye-bye.
Bye.
Bye.
Yeah.
Good night, all. Good night.
Good night.
Nilupul,
Night.
Yeah.
Now only my how then make a local.
Thank you.
There are some doctors are still in the class.
Yes, we were participating in this, I guess.
Ane to sit. Please, our team members, if you can please. There are some noises. If you can, monkey we apay team ke members. Hello guys, be mindful. To sit, be mindful. Nilupul, be mindful.
Yeah.
Hello Dumit, ඒ නමන් තියන්න අපේ කට්ටිය පොඩ්ඩක් ලොග් කරලා අපි thank you එකක් කියමුනේ කට්ටියට මේකෙන්. ඔව් log වෙලා අපි අපේ මගේ ඔව් මහේෂ්ටයි අනේ මේ අපේ ටීම් එකේ කට්ටියට පොඩ්ඩක් log වෙන්න කියන්න. Nilupul.
Yeah.
Nilupul.
Yeah.
Nilupul අපේ ටීම් එකේ කට්ටියව තියලා sorry.
Thank you very much, sir. හොඳයි සර්. මං CD එකත් අපි රෙකෝඩ් කරා සර්. මං CD එකත් ගෙනත් දෙන්න සර්. සර්ට දන්න මේ ડોක්ටර් සර් ෂෙයා කරගන්න පුළුවන් සර්. Okay sir, thank you very much sir.
CD එක
Raji.
Raji.
CD
මේ sorry sir. මයික් එක ඔන් වෙලා නේ.
Sorry sir again. අපිට එපා sorry sir.
නෑ මයික් එක ඔන් වෙලා.
මගේ වීඩියෝ එක බ්ලොක් කරලාද කරවලේ මට වීඩියෝ එක ඕපන් කරන්න බෑ
දැන් වැඩන්න
Yeah, start your video because the host has stopped it.
Susit දැන් බලන්න.
I'm gonna block කරලා
දැන් ලස්සනයි.
දැන් ඔයාලා වැඩේ කරනවා නේද?
ඔව්. නිරුපුල්
Yeah.
හරි නේද?
හරි නේද?
නෑ තව නෑ.
තව නෑ
මේ අපේ කට්ටිය නෑ.
නෑ නෑ.
දැන් හරිනේ.
අපේ කට්ටියත් ලෙෆ්ට් වෙලා වගේ.
ඔව් ලෙෆ්ට් 19 ඉන්නේ දැන්.
19ක් තියෙනවා.
19ක් නම් හරි.
කුණාල් බානුක දිලීප ලංකා ආර්ථිකා කවුද නැත්තේ?
හරි අපේ කට්ටියගේ
වාසනා.
දැන් අපි විතරයි ඉන්නේ.
වාසනා නෑ. මේ කවුද දිලීප වාසනාට පොඩ්ඩක් එන්න කියන්නකෝ.
තව කවුරු හරි අඩුයිනේ.
පවන් සොනාල් සචිත්‍ර ඉන්නවද? සචිත්‍රත් නෑ.
සචිත්‍ර ඉන්නවා.
සචිත්‍ර ඉන්නවා.
Right, guys. Good evening, guys.
Good evening, Mr.
Good evening, Mr.
Good evening, guys. Can you now you can අර recording වෙන එක නතර කරනවද? recording නතර කරන්න වෙයි නේ.
හරි.